Hi friends, myself Dr. Ayush, your surgery faculty at Global Academy of Medical Education. At GAME, we have come up with this series of final lap surgery for NEET where we shall be discussing around 4 to 5 important previous year questions from surgery that have been asked in NEET. We shall have a special emphasis and focus on your last 2 years, that is your NEET 2021 and NEET 2022. So let's begin our discussion for our first question. A patient presents to you in trauma center following road traffic accident with your respiratory distress, tachypnea, no entry on air on the right side, vitals are unstable, your pulse and blood pressure are unstable. What will be your immediate management? So the first step is to form a diagnosis that we are dealing with in this case scenario. So it is a case of your tension pneumothorax. Now, what will be your immediate management in case of a tension pneumothorax? Now, tension pneumothorax is your clinical diagnosis. So, it being a clinical diagnosis, we do not wait for any radiological investigations, right? So, obviously, your EFAS would be ruled out. Then, what is your management in case of tension pneumothorax? It is an insertion of a wide bore needle in your fifth intercostal space in adults, right? Whereas in children or in a pediatric age group, it's in your second intercostal space in mid clavicular line, right? So this has been asked in your NEET 2021 as well as in your NEET 2022. So let's take a look at some of the important points of your tension pneumothorax. So tension pneumothorax is a one-way valve air leak through the lung or the pleural wall, where your air is forced into the pleural space, as a result of which there is no escape route, leading to the collapse of the affected lung. Now, the mediastinum is displaced to the opposite side, causing the decrease in the venous return and causing the compression of your opposite lung. Now, the shock that occurs in your tension pneumothorax is your obstructive type of shock. And the most common cause of your tension pneumothorax is the mechanical positive pressure ventilation in patients with your visceral pleural injury. Right. It is a clinical diagnosis with no delay in your radiological examination, and the manifestations of your tension pneumothorax. If your patient is mechanically ventilated, it would present to you with an hemodynamic collapse. Now, if the patient is breathing spontaneously, it would present with your tachypnea, air hunger. Then you have your respiratory distress, tachycardia, hypotension. So this were your clinical key features that were given in your question, leading to your diagnosis of your tension pneumothorax, right? And there would be unilateral absence of breath sounds, neck wing distension, and cyanosis. So look for these clinical features to diagnose your tension pneumothorax in your clinical scenarios, right? Another way of putting this forward, the question is like giving your X-ray image along with your clinical scenarios, right? So this is a classical picture that has been even given in your Bailey and Love of your tension pneumothorax, right? And regarding your management, your immediate needle decompression, as we have already discussed, in your fifth intercostal space, and your definitive management is also your placement of your fifth intercostal space, a chest drain. Now, regarding your triangle of safety, where your chest drain is usually placed, is very important is your boundary. So posteriorly, it is bounded by your latimus dorsi. Anteriorly, it is bounded by your lateral border of your pectoralis major muscle, right? And inferiorly, it is the line perpendicular to the nipple going to the back, just anterior to your mid axillary line, right? So even this question has been asked in your INI exam last year, so hence it becomes a very important topic for your upcoming NEET exam, right? So this were your few important points with respect to your tension pneumothorax. Now let's move down to our next question. So this was asked in your NEET 2022. Green in triage indicates for immediate, urgent, non-urgent, non-salvageable. So this question has been directly taken from your this table, right, where you have your triage categories. Triage means to sort or to prioritize, right? So you have your red, which is your needing your immediate attention, yellow needing your urgent attention, green needing your non-urgent, and black is your unsalvageable. So the question asked over here was regarding your green, so which is your non-urgent. Now a few important points regarding your clinical status and your example for your green. So if you look at your green, this is stable and likely to survive even if treatment is delayed for hours to days. In contrast, red is your critical but likely to survive if treatment given early, like your severe facial trauma and your extradural hematoma. In case of your yellow, it is critical and they're likely to survive if treatment is given within hours, like your spinal injuries, ruptured abdominal whiskers. And black are those which are unsalvageable, like your extensive burn and your severe brain damage, right? So this was asked in your NEET 2022, and your similar question on triage was also asked in your INI exam. So if you look at the trend, so the INI questions are getting repeated in your NEET exams, right? Now the next question that we have is your varicose vein in your CEP classification. Now this your CEP classification was asked both in your NEET 2021 and your NEET 2022. So varicose vein in your CEP classification is your C2. So now let's take a look at your CEP classification. So we have your C0, where we have no signs of venous disease, right? Then we have your C1, where we have your spider veins. Then we have your telangiectasia, and we have your reticular veins. Then we have your C2, which is your varicose vein. Then we have your C3, which is your varicose vein with edema, right? Then we have your C4, which are present with your skin and your trophic changes. So we have your C4A, which is your pigmentation and your eczema. Then you have your lipodermatosclerosis or your atrophic blanche. Then you have your C4C, which is your corona phylbacteria, right? Then we have your C5, which is your healed venous ulcer, and you have your C6, which is your active venous ulcer. So they have asked you direct questions from your CEP classification, whereas recent trend has also been giving you image and asking you the CEP classification. Like if you see in this image, this is your C2 classification showing your varicose vein. Then we have your this image, which is the C1 showing your telangiectasia, right? So telangiectasia are those veins, subdermal veins, which are measuring less than 1 mm. Then you have your reticular veins, which are measuring your 1 to 2.9 mm, right? And you have your varicose vein, which measure more than 3 mm, right? Now if you look at this, so these are your skin changes, right? So lipodermatosclerosis, which is going to be a 4B, eczema, which is going to be a 4A, and your atrophic blanche, which is going to be a 4B, right? So the next trend that is coming up is like giving you an image and asking you regarding your CEP classification. And please remember that the gold standard for your treatment of varicose is now your endovenous treatment, right? Endovenous in form of laser or your radio frequency. So no more of your open surgery, rather your gold standard treatment is your endovenous laser ablation or your radio frequency ablation, right? So moving down to the next question. So what is the metabolic abnormality in your pyloric stenosis has been asked in your NEET PG 2021. It is a very commonly repeated topic. So let's discuss a few important points. The vomiting is your non-bilious type of vomiting. Time of presentation is around 2 to 6 weeks. It is different from the infective causes as it causes your postprandial hunger. Now once the vomiting starts, the frequency and the forcefulness increases daily, which is a differentiating factor from your a differentiating feature from your gastroesophageal esophageal reflux disease, which basically waxes and wane, has an incidence of your 1 in 3000, more predominant in your male, and your test feed the gastric peristalsis move from the left to right in a feeding baby, that is a relaxed baby, and you can find a olive mass in your right upper quadrant. So these are some of the classical features that you can see in your pyloric stenosis. And regarding your metabolic abnormality, which has been asked multiple times, it is a hypokalemic hypochloremic metabolic alkalosis, right? And your correction would include your 0.9% saline with 0.15% KCl in 5% of glucose, right, at 6 to 7.5 ml per kg per hour. And your operative treatment would include your Ramsted's pyloromyotomy. So these are your few important points with respect to your pyloric stenosis. Most importantly, your metabolic abnormality, which is your hypokalemic hypochloremic metabolic alkalosis. And the last question that we would discuss in this video is regarding your MEN2 syndrome, which has been asked in your NEET 2022. So it was a very simple question that was put forward to you guys. Which of the following is not a component of MEN2B? Right, megacolon, morphinate habitus, mucosal neuroma, parathyroid adenoma. The answer would have been a parathyroid adenoma. So regarding a MEN2 syndrome, it occurs in two forms, 2A and 2B. The important features that are present in 2A include your medullary carcinoma thyroid, pheochromocytoma, hyperparathyroidism, Hirschsprung disease, and your cutaneous lichen amyloidosis, and the most common site is at your interscapular region and your extremities. Whereas M2B consists of your medullary thyroid carcinoma, pheochromocytoma, the mucosal neuromas, the most common site being your lips and your buccal mucosa. Then we have your GI neuromatosis, morphinoid habitus, megacolon, and your constipation. So these are your features of your MEN2B. Right, so a few important points regarding your MEN1. So you have this table from your Bayesian law. So you have your MEN1, remember your 3 P's, which are your parathyroid, pancreas, and your pituitary, right? So in parathyroid you have your 4 gland disease, in pancreas you have your gastrinoma, function pancreatic, non-functional pancreatic neuroendocrine tumors, insulinoma, glucanoma, right? So please remember your gastrinoma is more common compared to insulinoma. Then in your pituitary tumors, most common is your prolactinoma, right? And the other tumors include your adrenocortical tumors, mainly non-functioning neuroendocrine tumors of lung, thymus, and stomach, lipomas, right? And your MEN1 is also associated with your meningiomas and facial angiofibromas. A few important add-on points regarding your MEN1 and MEN2 would be summarized as follows. Now MEN1 occurs in your MEN1 gene, which is your tumor suppressor gene, encoding for your menin protein, whereas your MEN2 is because of your red encode, which is a proto-oncogene encoding for your tyrosine kinase. Also we need to remember the chromosomal mutation, which is 11 in case of MEN1 and 10 in case of MEN2. Right, so these are few of the important points with respect to your MEN2B syndrome, and we have a detailed explanation of your MEN syndrome in form of a video at your Global Academy of Medical Education channel. So those students who want to have more knowledge regarding your MEN syndrome and want to revise it can take a look at the video. So we end this video with this 5 questions. Today we'll be coming up with more such videos before your NEET exam to help you revise better for your upcoming exam. So keep revising, and we are pretty sure that you all guys will do very well. Thank you.